I have to say, it is pretty awesome to be on this side of the discussion. And I am especially excited because I get to interview our company president and founder, Jack Dangermond. Thanks, Jack, for taking the time to have this conversation with me today.
It's my pleasure to be with a movie star like you. I mean, I see you on the news, I see you everywhere. It's fantastic. Yes, thanks.
And now everybody knows you have a great sense of humor. But, people in this audience have seen me in a few times over the last year plus, and I've been talking about the different ways that GIS supports health, but I really think it's going to be impactful and important for them to get your insights about both the technology side and how Esri as a company is making advances that will further enable health GIS users, probably like never before. And so I wanted to start talking kind of from a historical perspective. I'd love to get your observations about the evolution of health GIS, because Esri's been supporting this industry for more than 20 years, long before I got here. So when did you first notice that health and human services organizations could benefit from this technology?
Well, way back a long time ago, we began thinking about health statistics on maps. And I had the opportunity working with a good friend of mine, Bob Engenberg, to build the first national cancer atlas. And the technology was really lousy, thinking back on it at the time, but we were able to make these printer plates, which showed the patterns and relationships of cancer in the United States. And I learned a lot. I mean, as you would expect, geography and demographics are all interrelated. And what we noticed there, a map that really got my attention was stomach cancer, which was really concentrated in the upper Midwest. And it caused me to ask this fundamental question, why is that? Is there something up there? And my friend, Dr. Engenbroek, said, Jack, that's because there's a lot of Scandinavian descent in the population and they eat a lot of potatoes. And I thought, oh, come on, that's too simple. But different analytics, I mean, whether it's true or not, the visualization of this information caused me to start thinking. And then over the years, I saw people map their data. That was really some of the first work. And then later when Bill Davenhall joined us, he began to use real practical applications like where to locate a health facility and how to study the patients around a health facility, doing geocoding, visualization. And that just sort of started to open the door. And then when you came along, of course, things exploded and they continue to grow. But I think it's pretty powerful when you think about the concepts of geography, the science of our world, all the cultural geographic factors, and part of that is human health and patterns, combined with all of the physical and social geography of our planet. So it's a natural, I'd say. I get excited about it, frankly.
Well, that makes two of us. But I really love that story about the Cancer Atlas. It's great for me to hear that was your first endeavor in Health GIS, because I actually used that atlas. We have a copy of it at UC Davis. And I had my class do a project with it. And so that was pretty cool. And in fact, we knew it was from the 70s based on the cartography colors. It kind of matched the appliances of the day, right? That kind of yellowy color and the olive green.
Yeah. Well, that's good.
Yeah, it was. That's a lot of fun to get that connection. But I know that things have modernized. You've mentioned that. What do you think have you seen as emerging kinds of applications of GIS in health lately?
Well, I suppose I'll show a few slides. These are some slides showing the patterns of showing demographics and health information, just thematic maps. And I see that pervasive, not just in COVID, but people are studying the patterns of geography, patterns of human health and geography using just simple thematic maps. We can see here the census information. The census in 2020 was all done using GIS, field people collecting statistics, putting it into the database, and then being able to visualize it. But these examples show research going on in lead poisoning and the patterns as it relates to demographics, malaria transmission, polio cases. I mean, this conference really highlights a lot of the users who are listening, their work. And so it's pretty common, I would say, and it's just beginning.
Yeah, absolutely. I totally agree with that statement. And I love that you showed, especially, I mean, all of these are great examples, but I love that you included the lead poisoning map. And it reminds me to tell this audience that one of the things that I think is that lead poisoning is going to be even bigger going forward, because we're seeing funds provided in the American Rescue Plan that's going to modernize some of the pipes that are lead-based and get those up to code, so that but GIS can actually help figure out which ones to start with, where's the biggest problem, and do things like testing and inspections around lead poisoning. So I love that. Actually, GIS has this long history of helping organizations during times of crisis or disaster. And yesterday, I made some comments about our colleagues in public safety, and in that industry, I think they've made some really great strides getting more modern in the ways that they use GIS technology to support that public safety work. So what do you think those disasters have taught us about GIS's use and how we could use it to respond quickly to COVID-19?
Well, in the beginning, just like those maps that I showed on health, we see patterns in the data visualized. But in a pandemic, just like any other disaster, people begin to map out the information as a first step, like you did with mapping the cases, and then do step 2, systematic analysis of that data behind it, and then step 3, being able to make forecasts and predictions, and then respond, and then do recovery work. So these examples that are shown here on the screen in earthquakes and tornadoes and fires exactly follow that methodology. It's very similar to what epidemiologists suggest is epidemiology. You know, you're mapping it, you're analyzing it, you're doing something about it, as a matter of fact.
Yeah, in some ways, I'm always surprised that there's, and we talk about this, right? There are patterns of GIS use that are applicable over and over again, and yet a lot of the ways that we apply that spatial thinking seem very unique and different. So there's sort of some almost cognitive dissonance there, but also some parity that is interesting to explore. And I think this is great work that public safety's been doing, and I recognize that there's a lot of overlap of human health in many different kinds of disasters. I know that we had some involvement in assisting organizations with Hurricanes Katrina, Hurricane Harvey, the Fukushima disaster. Those all had health components to it. But for the last 14 to 16 months, of course, it's been all about COVID-19. So what do you think were some of the key applications in GIS for COVID-19?
Well, these slides actually show some of the work that's done by the users, from Johns Hopkins all the way down to counties and cities and states and different ministries around the world. It started off by just doing case mapping so people could see the context of what was going on. It was very valuable. And then people began to integrate the CHIME model and forecasting model to understand the patterns of geographic forecast overlaid on top of hospital facilities or facilities in general, and then understand how the impact's going to happen, even in advance of it happening. This was very powerful. And some of our national agencies, like the U.S. Army Corps of Engineers, they made the forecast spatially and saw how it would affect their response, the actual work done by the Corps or by the military in various settings. Even firefighters, the Association of Firefighters, did the same thing to understand how it was going to affect. And everybody was, as you remember, a year ago, people were just panicked, how it's going to affect my workers. And so that was one of the big ones. Later in the epidemic, in the pandemic, we saw attempts to look at contact tracing, interrelating people, and trying to figure out how it was spreading. And then people jumped into action using fundamental tools like location and allocation. This is a set of mathematics that help people pick the best location for something. Fire station, people use it for picking the best fire stations, but actually it kicked in and was used for picking the best places for locating testing sites, and then later now and continuing now the best places to get vaccinated. And it involves some complex mathematics, but you could just imagine Starbucks. How do they always get it right, picking the right location? Well, it's the relationship between demographics and consumption of their products, and it brings all those factors together. So being able to cover the population equitably within certain driving distances became a tool that was applied widely. And now, of course, just monitoring. I mean, the president sees every day dashboards that are unique to him that show the progress that's being made in his first 100 days and beyond. This is very valuable. These are also some dashboards that just speak to the whole communicating to the world. The Johns Hopkins map, was looked at over 2 trillion times. Can you imagine that? So
Amazing.
they say that over half of the population of the world has at least seen it once, and many people see it many times every day. But the other examples here simply show specialized dashboards for executives, or specialized dashboards that understand the relationship between the pandemic and civil unrest happening there in Europe, and on and on. So these are a few of the key ways that it's being used. And it's, by the way, I mean, with a resurgence in Europe, with a resurgence in India, with what's going on in Brazil, this is not done yet. I mean, sometimes living out here in California, we're thinking, oh, phew, it's done. It's not done. It's really emerging, and the tools like hotspot analysis are being used to understand what's trending upward in hotspots and what's trending downward in hotspots. And that's a global thing. And of course, this visualization helps us understand what to expect next.
Yes, absolutely. I mean, you covered such a huge spectrum of all of the things that have really supported the pandemic. And I wonder, my next question is going to ask you to maybe look forward a little bit. What do you think COVID is teaching us that's going to help us prepare for whatever's next?
Well, okay, that's an open-ended question. We could talk all day about this, but the first thing is that I think location matters. And I think the health community did not really understand that to the level that it understands it today. And again, thanks to the Johns Hopkins work, this was amazing, because they sort of brought it home that integrating location into health information is vital to really understanding it. And not location like, oh, it's happening in this state, or it's happening in this county, or it's happening in this zip code, but it's no. I mean, one of the big lessons that I'm hopeful that the health community knows is that specificity about location, like it's happening here, and that affects what's happening right there. This kind of driving home location at the individual case level and at the aggregate level is extremely important. And another big lesson that occurred out of all this work was that that we need to collaborate more, and we need to trust information. I mean, the great gift that Johns Hopkins did is they aggregated data from many, many sources and then made it available to the public. And that's another big lesson, is a citizen engagement, connection with the public, so that they understand, they have situation awareness, as the military often talks about. And that changed the world, I think it made a huge step towards people understanding around the world that we're all interconnected and that we're all in this, and that was kind of like that's going to be an impact that's felt as we try to collaborate to deal with climate change and other major issues that we're facing as a global society. One of the big technologies that we introduced some years ago is called a hub, a GIS hub. And this started to become deployed, especially in the later phases of the pandemic. And these hubs are literally transforming the engagement. That's what it's about, between an agency with their information and the community that it serves. This diagram simply shows I can make maps available, or through dashboards, I can see what's going on, but engaging the people on the other side, whether it's in a nursing home or in a local government, feeding information or sharing information, these are this is a pattern that I think will be very important going forth, involving stakeholders. Like here in our little inland empire region of Southern California, getting all the hospitals, all the healthcare providers, everybody collaborating and working together. This is something that maps and apps connected to real people can really help a lot with.
Yeah, I think so. I feel like interconnection is going to be one of the key themes of the day, of the decade, maybe. And I love how hubs are so good at interconnecting people. And then I also wanted to mention to this audience, and you mentioned it, the idea of interconnecting systems and interconnecting data, like Johns Hopkins dashboard. What some of the members of this audience might not know is that GIS has advanced, and we've been working on being able to interconnect with HL7 fire databases, fire servers, so that health systems and disease surveillance systems can now make use of that data in GIS so much more easily. So I think that interconnectedness point is really relevant for this audience.
Actually, you just brought up a thought for me. Is just in the beginning of the pandemic, nobody trusted anybody about the data. And I am a great respectful person about HIPAA and the need for privacy and security on data. Don't get me wrong, but the ability to share information and then integrate information from a cultural perspective was really one of the blockades that held back being able to respond effectively. That's my personal opinion. So I think if there's a walkaway, that's something that we need to continue to work on as an organization, as a community, so that we document the patterns for being able to mobilize quickly. Speaking one more thing about the hub, this is a technology that lives in the cloud. You can take map services into it and then make it available through these various kinds of apps. And these are not hard to stand up. So I would simply say hub made a big difference, but it's didn't make enough of a difference. There's going to have to be more work done on this. And well, it's simple enough. I mean, I even heard that you stood one of them. That's amazing to me. Not, you know, I'm not criticizing you, but it's quite extraordinary that you did it.
Yeah, well, we keep talking about that it's pretty easy to do, and we've created some of these tools to make it configurable. And, you know, I always feel it's important to be really honest with our users. So I wanted to see if I could do it. and
no, that's good.
Yeah. So I'm a true believer and try to be completely honest. And so you're mentioning like this idea of hub and WebGIS in the cloud. We talked about dashboards. Mobile tools have been really important.
Yeah.
But I wanted to get back to, you mentioned a couple of the different spatial analysis tools, and I thought maybe we could talk a little bit more about those, get into a little more depth. I love that you talked about the CHIME model. I think that's probably one of your favorites, and the location allocation. Was there anything else that you wanted to say about the impact of some of the analysts in the virtual room?
Well, before that, I thought maybe I'd bring up one of the things that emerged very rapidly at the very time of COVID was the whole issue of social equity and being able to integrate that in and understand different communities effectively as it was related to response. And this is again going on. I'm listening to NPR driving down here this morning. It's still an ongoing discussion because the disparity of work here that with well-intentioned people can often miss minority communities, or people get segmented out for one reason or the other. This morning's NPR was about language, and I guess in Boston they were really talking exactly about this. So there wasn't enough translation, and as a result, there was a disproportionate community, especially in the Hispanic community, that just died like 30% more because the language wasn't able to really communicate with people. But some of our users' work here on this slide show some great efforts. Like in San Antonio, one of the great GIS users, they built an interactive equity atlas. And what this meant is a series of demographic reflecting cultural backgrounds and racial backgrounds layers, so that if you allocate money in the city, whether it's for street improvements or whether it's for allocating resources to respond to the pandemic, you can evaluate it through a racial lens or through a social lens. And then glance across this screen. This idea of using geography and GIS specifically to see differences in community is, you might call it spatial analysis. It's sort of a visual spatial analysis for sure. There's tons of other capabilities that emerged rapidly during the crisis, but some of the big ones from my perspective were things like time series forecasting. You know, CHIME developed, I think it was at University of Pennsylvania. Please tell me if I got that wrong, but I think it was.
You're right.
Right, okay, I did remember that. That technology we took and integrated into the ArcGIS Pro desktop right in the middle of the crisis, which allowed us to spatially make forecasts and overlay these on top of hospitals. So I'd say that hospital capacity analysis as it relates to forecasted information not only impacted this crisis, but also, by the way, is now being used for other kinds of forecasting of information. Another one is the location allocation. I think I've talked about that in those examples that were shown. And then there's this idea of space-time data cubes that allow us to see the emergence of hotspots differentially, emerging hotspots and declining hotspots, you know, getting cold spots. This was really the great work of Lauren Bennett and her colleagues, building tools into the overall effort. But there was lots of other innovations that are going on here that affect the health community, as you know. But I can share some of those if you'd like.
Yeah, I definitely get to that in a moment. I think I just wanted to comment on the space-time cubes. I think they're so useful, and I would love to see this audience use them more. They're very good at hotspot analysis, and I'd love for them to add to the time component, because we saw some really interesting relationships. For example, the social distancing grades over time, and then comparing that with weather conditions. And it became easy to see that we had a big problem when the weather got warmer. People social distanced a lot less. They wanted to get out and enjoy the outdoors, the beaches. But I think those kinds of insights help you to develop policy. But, I think one of the things that I really love about working for you and for Esri is that we are always looking to the future. We're developing new technologies and increasing our capabilities and the efficiency of the work of our customers. And I think it's really exciting now because a lot of those are relevant to our health customers, maybe more than even some other groups. So I would love for you to talk about some of the innovations that are going to be important to health users.
Well, some of the innovations happen as a result of the crisis, actually. We're paying now much more attention to privacy and security and data. And I'll simply say customer information, data privacy is kind of a core value of us. We're not hoovering up data, into our system. We don't really care. But so setting up safeguards in our cloud platforms and in our use of geographic data within organizations is really an important thing. And I think the pandemic, it's sort of sad to say it took a pandemic for us to really mobilize in it. I don't think it was just the pandemic. I mean, the Europeans here in the state of California, our FSMA compliance and the national government, all of these things are coalescing to really drive home the need for more attention and GIS on this, and we've got that one. The second one is an innovation that I think will continue to kick in is the use of GIS in indoor facilities like hospitals, rooms, security reasons, and just management of space. And this will continue to advance as we bring people back to offices in the commercial sector, but also in hospitals, just understanding the dimensions, spatial dimensions of how epidemics spread inside of a hospital, or with the safeguards to do it. The third area is shown on this slide. A new pattern is actually emerging, which is GIS in the cloud. It interconnects server systems and desktop systems with SaaS systems that can be accessed through various kinds of apps. The dashboard is an example of one of those apps, but also field work is an example. And this architecture of an integrated system of systems is starting to emerge. And I'd say that's one of the big, frankly, one of the big patterns that's going on. A second one is the one that you mentioned is spatial analysis. And there are several thousand of these tools like location allocation. And we've talked about this time series forecasting work with Chime and others. But look at all these new ones that were just emerged last year. The ability to work with very, very big data sets. And I imagine after the pandemic is over, there'll be gazillions of dollars spent on trying to understand these space-time cubes with the billions of observation data. So it's going to be a gold mine of information looking at space-time cubes on the history of the pandemic. And using AI and machine learning is emerging. The integration of Jupyter notebooks is really new to GIS in the last couple of years, but it's not new to many of the people in data science within the health science community. But being able to fuse these two things together, as well as the integration of AI and machine learning and deep learning. Our approach on this has been to make ArcGIS just what it is, but support it by integrating open source and open data science ecosystems into it, making the connection between the GIS community and that community using notebooks, Jupyter notebooks, and also using Python and the whole R. So we have a new bridge into that space. And that's going to give us new insights, like we'll be able to see things that we couldn't see before and also make projections that are phenomenal. And there is the GIS community, the GIS professionals, and many of our audience listening today are those people. But we have been working on a technology called Insights, ArcGIS Insights, which is for a more data science community and a more casual community. It, like some of the Tableau or Power BI community users, allows you to do drag and drop of data and do geospatial visualization and analytics, spatial analytics, and create reports, all in a sort of GIS, kind of a simplified way to do GIS. And I think that's one of the big innovations that is emerging very rapidly. It'll open up the world of geospatial thinking to a much larger community. And I guess the last thing I'll mention is this connection with mobile solutions. And this one is called ArcGIS Field Maps. That's the most important one over on the right. It's connected in with the cloud, so you can collect data in the field on your iPhone. You know, we're all walking around with these now. This is an app in the iPhone where I can collect either statistical data or feature data and share it in the cloud, and then look at it at the same time in dashboards, like on the left side of this dashboard. How do you tell stories that really allow this to be understood? Let me share the one about WHO, who is doing polio immunization in Baghdad using the Collector app, and at the same time, or Survey 123 app, and at the same time in Geneva, they were seeing on a dashboard the progress of their immunization program. So being able to also locate where health workers are or where workers are and see them in real time as it relates to different kinds of incidents is critical for some of the other disaster work that our users are doing. And just directing work, seeing work, tracking work, capturing data. And as you know, this was a big technology used in this pandemic, where nursing homes were reporting through Survey 123 into integrated statewide systems. We were able to take, observational data of all different types. So these are, I think, some of the innovations, frankly, that are going to continue to push not only the overall GIS community, but particularly the health community going forward. And so I'm excited about it. I mean, we keep investing in virtually all the money that we get here at Esri into pushing that envelope. We have a couple thousand developers who just keep looking at visualization, mapping, data mapping, integration, security, all these sorts of things every year. And so our long history has been this sort of evolution of GIS. and you in charge of the whole industry of healthcare and health sciences. You push those people around. I get what you do. Or you
Thanks.
talk to our users and direct those engineers very well. So thank you for that, by the way.
Oh, you're very welcome. You mentioned all of the things that I think are so relevant for our health users, and particularly the whole idea always strikes me of getting real-time or near real-time data. That's such a relatively new concept in health, except for certain parts of the health audience. Often we wait, a year or two before data is cleaned and ready to use. So right. I think it's so exciting. And
people talk a lot, they talk a lot about automation of data. And that was certainly a phase in the sort of computer industry of automating, and this is happening in healthcare as well. But now they're talking about digital transformation. And that really has a different meaning. It's also using computing and communications, of course. But in the case of taking observation data and linking it into the cloud to people who actually act on it at the same time, this is transformational. And we had a struggle with this during the pandemic because it wasn't all interconnected. And if we had the pandemic to do it all over again, and there was enlightened management to understand what the power would be, I would hope that this transformational technology would mean that we would have more or less in actual real time the observation of the pandemic and our ability to act and be more effective in our action. So we say understanding, which is what GIS is all about, understanding spatially what's going on, precedes action. It's a favorite phrase of Richard Saul Wurman, the guy who started TED, So we say GIS is transforming organizations. It's helping them understand and see better and connect with their constituents, the citizens, everybody, society. And also building the base for us to be able to more intelligently act, to carry out those actions that would, contain, put it into a box, manage our limited resources more effectively. So to me, that's the big exciting part of this.
Yes. So as a last, maybe sum it up, wrap up question, you mentioned a few things that I think may come into this, but this audience is here listening to you. What would you love to see health organizations accomplish with GIS in the next 3 to 5 years?
Well, there needs to be more literacy about what's possible. I think of it as geospatial literacy within the whole health community. I think I already said it in a way. If everyone had really understood what the power could have been, I think we could have addressed the crisis and the pandemic more effectively. I mean, there are many ways, there'll be many books written about this pandemic, but one of them I think that certainly must come out will be the documentation of why location matters in health information. I would like more advocates. I'd like more scientists, data scientists involved in this. I'd like more epidemiologists to both understand it. And there's a huge opportunity here. This is one pandemic, but at a global scale. But we have other pandemics, coming. That's sort of a good thing and a bad thing. But the parallel pandemic is climate change, and so I don't know that the health community themselves can do it, but it can certainly be an example of what must be done. We must all get engaged. This is going to take, just like the pandemic, it's going to take everybody working, whether they're science people, whether they're technology people, whether they're normal citizens, it's going to take everybody to address this next big wave that's going to affect society.
I think you're right. It sounds like there's a lot to do, and I'm going to get to work on that for my part. And I just want to say thank you, Jack, very much for your thoughts and your insights and sharing them with me, but especially sharing them with our health and human services community. And
I think it's me to say thanks to you on behalf of not just our community, but in everything. I mean, you've done an amazing job of leading. I don't think I really answered your question. I think I want more of what you do, more of your insights shared, more people that actually will follow through with doing the great work that they did in the last year and propagating this in education, in research organizations like Johns Hopkins, in the science community, in public health organizations, in hospitals and associations, and state agencies, national agencies. They need to take more advantage of this incredible thing. And they did a lot of it. I just think there needs to be more of it. So again, thank you, Este. Appreciate it.